fused. So the work that we do is to feel how the plates are aligned with each other, and I put my hands on and I feel them, and because they're not yet fused, very gently, subtly, I can move them. Some of the crucial work for a baby is that the 12 cranial nerves, which are the nerves that come right off of the brain, they go through holes in the skull, and 3 of the nerves go through one hole called the jugular foramen. And if there's any compression there, then it can put compression on those nerves. That is cranial nerve 9, glossopharyngeal for the tongue, so any problems with feeding. 10, the vagus nerve, so any problems with colic or reflux can be affected with that. And 11, the spinal accessory nerve that comes to the sternocleidomastoid muscle, so any problems with torticollis. Yes. Babies aren't crazy about having their necks touched. So.
And you can feel when there's a difference, or when there is like a hardening.
I can feel the symmetry in the bones.
Okay.
And that's primarily what I'm focusing on, and helping to balance the symmetry in places where I feel like there's tissue restriction, where it's a little bit harder. Just by gently putting my hands on, we can help that area soften up and become more balanced. Now, when I say soften up, I'm not talking about softening up bone.
Right.
I'm talking about like a tight muscle sensation. Just the same as an adult can feel a tight muscle. Happens with the babies too.
Yeah.
Yeah. So now I'm going to do what's referred to as a frontal lift. He's got a little bit of suture overriding. Suture is the name for the joint between the bones and the head. So I'm going to very gently put my hands here and kind of pull gently forward so that it creates a little separation in that joint right there. And you can see it doesn't seem to bother him a bit.
Right.
Yeah. Sometimes I actually feel babies really leaning their heads back into my hands. You get a sense that it's very relieving to them. If I have a student with me, sometimes I'll have them palpate this joint, and they can actually feel the separation.
Wow.
Now when I let go, it will fall back a little, but not as much. The startle response. Yes, these feel good here. That feels good there.
And then I was reading too about the vagal massage or any of this manipulations, how it really does help with growth, with weight gain. I guess that's because if there is an issue with the tongue, or then you're helping that.
Right. Now I'm going to work on his neck a little bit. Like I mentioned, babies do not like it, which is so interesting because adults really love it. But it has something to do with the developing nervous system, that a baby's nervous system isn't as developed. And he's not minding it one bit.
He never sleeps like this at home.
Oh. Yeah, after I do this work, sometimes I'll have a very deep sleep. Yeah. Yeah. Okay. Well, the neck is not an issue for him. If it were, I would do some stretching, like a baby who comes in with torticollis, which you could think of as a wry neck. Preference for the head turning in one situation, in one direction.
Okay.
I'm going to turn him a little, and I'm going to feel what's going on in his tummy. There we go. And we get more little bits of startle. Yeah. So what I'm doing is just putting my hand on the abdomen and seeing, again, the tissues, if there's restriction in one direction. And it just helps to relieve any tension there, which will have an impact on the whole thorax,
Okay.
And pelvis area. I can teach you a little massage that you can do. One of our graduate teaching assistants does this for her baby before she goes out. It can help to encourage a bowel movement. So when you take your baby out, the bowel movement will have been completed.
Okay. That's good to
She
know.
does it about an hour before she takes her baby out. Starting in the left lower quadrant, you kind of scoop up the abdomen, kind of like grabbing a pile of wet sand,
Okay.
and just kind of pulling it toward the midline and a little bit in a downward direction. And then you come up to where the ribs are, and again, just kind of gently. And it's just massaging the intestines a little bit to help stimulate a bowel movement going through.
Okay.
Here's the ribs. I'm not on the ribs, I'm under the ribs.
Okay.
Yep. And come over here to the right side. And what I'm doing is backing up along the direction of elimination. So, stomach's over here,
Okay.
small intestines are all over. Right here, they empty it into the large intestine. At the cecum, it ascends, comes up, transversely goes across, descends over here. Then you have the sigmoid colon and then the rectum.
Okay.
Okay? So if we start here, we're starting at the end of the tube.
Okay.
And then we're backing up in the direction
Makes
in which
sense.
it moves through.
Okay.
So if you've got this long tube full of something, here's the exit. You don't want to start here. It's going to
Right.
get all caught. So you start here, pushing in the eliminatory direction and
Okay.
backing up.
Okay.
Yeah. And then I'm going to work on his back a little bit. I'm going to put his whole body in my hand. You can see right there that his butt is in the palm of my hand. My fingers are pretty far up so that I can get the whole thoracic and lumbar region in there. And then I can just bend him a little bit and see if there's any restrictions in his back. Yes, and he does very well. Yes, very well. Ooh, right there. Oh, yes. And then the technique I'm using is called articulatory, where I'm gently moving him in the direction that he was a little bit restricted to get a little bit better range. Yeah. And that's it.
Unbelievable.